All right. So thank you everyone for joining us this evening. My name is Catherine Bamberger, and I'm the current president of the Albany Fund for Education, which is a partner with the City School District of Albany in making sure that every student and every school has every opportunity to become their best selves. This afternoon, we have put together a panel of experts to help answer your questions about the COVID-19 vaccines. Again, I'd like to thank you for joining us, and we look forward to hearing your questions. You can also use the chat feature, and we'll be happy to feed those questions into our panel of experts so that they can weigh in with some answers. With that, I'd like to welcome our Vice President, Barry, and please take it from here. Barry Walston.
Great, thank you everyone. I am excited about this discussion, this exchange with the community. I'm a board member of Albany Fund for Education as the vice president, and we are really looking for these particular ground rules. We want you to be engaged, we want you to be active, and we want to inform you. So we want you to be informed. So we're really excited about this, and please just thank you for being present and joining us with this discussion. My task is to introduce our moderator, who is another colleague and a peer and a board member, and that's Paul Collins Hackett. And so with that, Paul.
Hey, good evening, everybody. First and foremost, thank you to everyone for your time. You could be anywhere in the world, but you're here with us. Thankfully, locally, there's a snowstorm, so we have some people trapped in there, our captive audience. But thank you to our panelists, and I'll introduce our panelists. I'll kind of facilitate this discussion, but it's a lot of questions that we all have on our minds, a lot of answers that we're all looking forward to. So it should be pretty straightforward. If anyone has questions, you can submit them in the chat, and we'll make sure to try to include those as best as possible, giving time allows. We'll go through a couple of different questions. Our panelists will weigh in. Then at the end, we'll have an open Q&A for if anybody has anything else that came up that you thought of, feel free to jot some notes down and bring that question up later on. So that being said, I'm going to go over our panelists, and then we'll get into the first question. So we have Dr. Janice Pride-Boone. She's a pediatrician in various settings for more than 40 years. Although she's semi-retired now, she does travel doing medicine with her nonprofit, Strong Me. Thank you so much, Dr. Pride-Boone, for joining us. We appreciate you. We have LaQuetta Ellis. She's the co-founder of the Hearts and Minds Training Center. Again, physical fitness, a lot of what we need to do. We need to hear from you. Thank you so much for joining us. Definitely appreciate you. I've been practicing these names, I promise. So if I don't get them 100% right, please don't blame my head, not my heart. We're trying. Dr. Boahema Pinto. She works in emergency medicine at Albany Medical Center. She completed a residency at Albany Med, has her medical degree from University of Rochester, and still found time to join us here tonight. So we appreciate you. And last but not least, we have the incredible Miss Brooke A Raveendranath. I've been working on that too. She's an AFB board member, but also a pediatric nurse practitioner. Again, we've gathered the best of the best to answer our questions and trying to give us the most insight as possible. So with that being said, I guess the first question that we'll jump into is one that, you know, we've heard a lot, we've received a lot from a lot of different people. First and foremost, are the vaccines safe? How do we know that they're safe? You know, they came around pretty quickly. I think that's been something that we've heard from a lot of people, that they were developed pretty rapidly. In that case, can we trust their safety? And, you know, how do you guys feel about that?
So I can start. Tackling, there was a few questions in that. So maybe with the part about how it happened so quickly, because it's been mentioned many times that vaccines usually take on the order of like 10 years, 5-10 years is what typically we're used to. But this one was clearly in a year in a setting of a pandemic. And so I was interested in this too at the very beginning, like, how did they do this? And I was kind of fascinated by some of the things I found out. So it was a few things. So first of all, coronavirus. So SARS-CoV-2 implies that there was a 1. So there was a SARS, pandemic before this. SARS has been out there. MERS is related to that. So the point is, researchers already knew a bit about the SARS sort of virus. I mean, and coronavirus is a bigger family. So coronavirus, we see that in medicine all the time, well beyond, well before COVID. It causes the common cold. So first of all, the researchers knew a lot actually about corona in general as the family. And then when you talk about the vaccines, the mRNA vaccines is the big one that we tend to talk a lot about, Pfizer and Moderna. That technology is new as far as COVID goes, but it's not so new. Researchers have been using that, looking into that for about 10 years plus. So again, they weren't starting from their bottom, so that was helpful. And then you take in the fact that the whole world essentially had to come to a halt, right? Like everything literally stopped and we were, everyone is at home. So that includes researchers, that includes everything. So labs closed and everything went into this one question. So you have every researcher, almost every researcher, and not like the US, but the whole world, everyone is working on this one problem. So that helped a lot. And then also when it comes to a part of the reason why it takes 10 years or however many years for vaccines to be made, there's a lot of red tape in that. And there's a lot of money is a big thing with that too. There's many phases to trying to get a vaccine approved and put together. And at each phase, researchers know all about this. They're looking for grants and money and trying to figure out how to make this work. There's a lot that goes into it. So a lot of that is the time that got stripped away. Suddenly everyone was, the government, private companies, everyone is like, here's the billions of dollars to get this done. We have a pandemic, we need to get this done. So all of these things is what made it possible to make something that would take 5 to 10 years, make it happen in a year. And when you think about it, it really makes sense. So the last thing I'll say, and then I'll let my co-panelists talk, is that there were a lot of trials that were done. So the shortcut part wasn't really a shortcut. The background work had been done already. And then the trials were done as they usually would be. So that's why I believe it's safe.
Absolutely. That makes sense. Now, from a safety perspective, I know kids have become a big concern too in schools and whatnot. So Dr. Boone or maybe Brooke, do you guys have a specific insight as far as whether young people should get the vaccine, or how do you feel about that?
Well, Dr. Pinto, you did a great job describing it. Actually, the technology is over 20 years old. And as you said, with MERS, the first vaccine was 10 years old. So they built on the first 20, and then they built on the first 10. And then, as you said, the last year was expedited because of the pandemic. So the technology has just been there for at least 20, then 10, and then expedited in the last year. So it seems like it came overnight. But in fact, we build them, as you know, with science, we build. And so with children, 5 million children have been vaccinated so far. And as you know, there have been no safety issues identified. So we know that it's a safe vaccine. Billions of doses of the vaccine have been given at this point over the pandemic over the last 2 years, which has been a remarkable pandemic. I try to keep a ledger of the positive, the negative, the last 2 years. I lost my sister, I've lost cousins, and early in December of 2020, when it first hit, we lost so many. And as you know, we're about to enter the endemic phase of this pandemic, and that's largely due to our vaccines. They have been so successful. And so I vaccinated numbers and numbers of children. They have done very well. And it has just been a remarkable, I've practiced over 40 years in over 15 cities. And my experience with vaccines have just been remarkable. I remember running down to ERs and seeing children die because of lack of vaccines. And the same is with the pandemic. So any small amount of side effects is minimum compared to having to watch a child suffer with COVID. So it's just remarkable what vaccines do. And I'm sorry for Dr. Google. Dr. Google has done some good things, but Dr. Google has done some terrible things in terms of making things appear to be worse than what they are. But I'm on the front lines. I see the children. I take care of the sick. And so I know the good of vaccines. I know what the world was like when I practiced 40 years ago. I know what it's like to see children with measles, mumps. Fortunately, I didn't have to see polio, but I know what it's like to have to take care of children with COVID, and thank God for vaccines. And we've again vaccinated 5 million children. You tell me where the sick ones are, show me that have gotten sick from the vaccine. So I'm grateful for them. I know the technology is been built over 20 years and it's safe. And I'm glad that we have them. I'm glad for vaccines.
Absolutely. No, I hear you. And that, that insight as far as the process, it definitely helps a lot. Now, Brooke, we talked a little bit about side effects. Do you have any concern about long-term side effects or things like that, either in young people or adults?
Excuse me, I do not, Paul. And, just as Dr. Pinto and Dr. Pride-Boone were discussing, we have personally vaccinated, thousands and thousands of children and, kind of been on the front lines and seen. And that is a question that parents have, quite often. They come in and they're hesitant, they're on the fence, they put their trust in us to, help guide them. And, what is their number one priority, right? It's their child. So that's also ours in seeing that child stays healthy. And the number one way is to vaccinate them against COVID. We are vaccinating children, as young as 5 now. So it has been very, very safe. My own children are vaccinated. They're age 10 and 13, and they did very well. In terms of side effects, mild, right? I mean, you can't say that nothing has a side effect, but when we give any vaccine, whether it be, polio, MMR, varicella, COVID, sure, you might have a little soreness of the arm. You may feel a little flush, have a small fever. Those are all expected, because what that means is that your immune system is, starting to recognize the vaccine that we're giving and create antibodies, so that when it does recognize the live, virus, when it comes in contact with them, whether it be at school, in the community, someone in their household, it's going to say, oh, okay, my immune system, it knows what to do. I can, fight off this virus and stay healthy and stay out of the hospital. And hopefully, it will provide, some long-term effects as well as what we're seeing in the new research that's coming out.
Absolutely. That helps a lot. And kind of in that same vein, a question has become a lot about personal immune systems and healthy remedies. LaQuetta, is there any way you can talk about, how can we boost our immune systems? What does that look like for people? Why is that not a viable alternative? And why do vaccines just make more sense? That question was for LaQuetta. I think she's muted. Okay.
Catherine, can you unmute her?
Okay, well, while we're working on that, same question, and I guess we'll swing back around to Dr. Pinto. We've heard a lot about the immune system and boosting our immune systems. Does that work? Is that not a viable alternative? What does that look like?
I mean, in general, boosting your immune system is important, of course, and not just for COVID, it's just for in general. And a part of having a good immune system is the food that we eat, and not putting toxins in our bodies, such as smoking, et cetera. All of these things help. But the problem is, once you're infected by a virus, having a poor immune system makes it worse, the potential side effects, but it impacts your immune system regardless of what you were doing before. So the problem is that all of those preventive measures will not be able to get rid of the virus once it's in your system. So vaccines have been they've been proven to help. So the other issue with having some of these dietary measures that we know help, but the problem is, how do you measure that? Like, we don't have studies that show that, oh, if you eat this amount of this will prevent, the virus from entering into your system. So having a healthy immune system is 1,000 times important. You got to do the steps beforehand, but you also have to it doesn't negate the effects of having the vaccine, which has been shown to prevent risk of transmission or getting the virus, but obviously it doesn't prevent you from getting it completely, but surely being able to fight the virus if you still get it. So.
Yeah, I think that was also a big question for people, that how do you take the vaccine and then still get COVID? That was confusing for a lot of people, and I'm glad you said it, so that helps a lot. Similarly, so when we're talking about the vaccines, and this kind of question is kind of open to anyone, there's multiple versions. There's the Johnson & Johnson, there's Moderna. That causes some confusion for people too. What's the difference between the vaccines? Anyone can kind of weigh in. And if there's like a really good one that's better than all the rest, then tell us that too. You guys are the experts, so we'll listen. But in general, with multiple versions of the vaccine out, why? What is that about? And that's open for anyone.
Well, as this is a forum for children, the only one approved for children is Pfizer. So as it relates to this forum, only Pfizer can be given to children because none of them are yet approved beyond Pfizer for children over 18 for Moderna and Johnson & Johnson at this time. Moderna showed the most efficacy against Omicron. So we had the highest response in terms of this particular variant. BA2 is having a rise now. It is right now a variant of concern. It's of interest and not of concern. It is doubling, but it's not having the effect of Omicron. So we have to take it variant by variant. So at this point, we seem to be in good stead. But at this point, they're all fairly good. But again, Pfizer for children, all of them for adults. But looking head to head, you need to do it head to head against what variant are you talking about? For Delta, they all look pretty good. But for Omicron, it was Moderna. But you have to look at it variant per variant.
So similar to that, in that same vein, when there's different variants that come out, are there going to be different vaccines that come out, or is one kind of going to cover for the most part all of them, but that kind of thing?
They're looking at a sort of a one vaccine that will cover all of them. That'll be on the market. They're looking now at a specific Omicron, which may have kind of be past tense now that it's passed and the numbers have gone dramatically down. It may not be a needed vaccine at this time, but they are looking at variant specific and one grand vaccine that will actually be coverage for all of them. That'll be a one-time shot that would cover all of them. But viruses are very smart. And unfortunately, as long as we have a large population of people that will not vaccinate, you will have the potential to have mutations. And as long as you can have mutations, you're likely to have a new variant that will outsmart us. And so you're constantly having to reinvent a new vaccine that will cover the new mutations.
Got you. That makes sense. And now I guess I have another question. So Brooke, there's a lot of questions about booster shots and kind of the follow-up process. So if, for example, I took a Moderna, would I be able to take like a Pfizer booster shot? Is it not good to mix, or do we get superpowers if we mix all the vaccines together?
Well, you are Batman, so but so you can answer that better than me. I can about superpowers, but yes, it is okay to mix and with boosters. It is okay. Some people, prefer to stick with the first 2 doses. Say they got Pfizer. This is again for adults, just like Dr. Pride-Boone was saying. We only have Pfizer approved under 18, but it is perfectly safe. And they have. Some studies have shown that, if you receive 2 Pfizer and then you get a Moderna, possibly it'll provide some more coverage, just again, like we were discussing before, but not a problem to kind of mix and match.
Yeah, I think the only one is if I may, the J&J, and I just saw this today, the J&J is the only one that I think the booster, they're saying, potentially Pfizer and Moderna, they're kind of recommending. But all the other ones I've seen, like you said, Brooke, like mix and match, just get it on the right timeline. Yeah.
Yeah, exactly. And they just for parents to know, also came out that you can spread out the Pfizer. So let's say you got shot number 1. Now you can wait 8 weeks to get shot number 2. So in case some parents were concerned, okay, why only, 3 weeks between, isn't that too soon, et cetera, they were obviously showing efficacy, but the latest research, they're showing that you actually can wait a little bit longer because it's providing a little bit longer lasting immunity. So just in case any parents were concerned about dosing time between the two, that is kind of the latest.
Yeah, and
Okay.
you had more likely to have a longer period of good antibodies and less likely to have any concern with myocarditis, which, as you know, became an issue with myocarditis. And there was a large study that came out of Denmark that showed that you are less likely to have episodes of myocarditis with the vaccine than you are to have episodes of myocarditis because of COVID. COVID will give you inflammation of the heart. COVID will give you MIS-C. COVID will give you diabetes. We've had a 3% increase of type 1 diabetes because of COVID. And you get long COVID, where you lose your sense of smell and you get confusion and memory loss, even in children. So COVID is a killer and a devastator of illness. So there's a good study now that shows that the vaccine will you can have, as was mentioned, side effects, but COVID itself is a huge amount of side effects. And as you just said, if you space it out more, 8 weeks rather than 3 weeks, you're less likely to have any side effects, and you're likely to have more weeks and months of protection. And you did mention the fact that you can still pick up Omicron with the vaccine, but you were less likely to be admitted and less likely to die. And in the red states, unlike the blue states, their death rate was tremendously high because they have a much lower rate of vaccination. So if you're vaccinated, you're less likely to die and you're less likely to be admitted. So you may have picked up the infection, but your rate of illness and death were dramatically cut. So again, much more like favorable if you're vaccinated than if you're not.
And if I can just piggyback off of Dr. Pride-Boone, like you said, so because myocarditis comes up a lot as a potential, concern about side effect from the vaccine. But like you said, the numbers for myocarditis from the vaccine was on the order of like 60 cases in 1 million doses, and is usually quite mild. I was speaking to my PICU friends about it and so forth, very mild.
Myocarditis, can you just explain that word, myocarditis? Long word.
That's a really good question. So myocarditis is inflammation of the heart muscle, or you can have pericarditis, which is inflammation of the lining of the heart. So the symptoms can be as mild as like chest pain, shortness of breath, all the way down to like it's your heart, so you need it to function. So then you can have issues with blood flow, low blood pressure, etc. It can be, in its worst case scenario, it could be deadly. But the thing about it is that most of the cases have been quite mild, especially when you're talking about with the vaccine. And that's what I was touching base with my pediatric ICU friends to make sure, because I work in the emergency room and I see everyone coming in, and I'm not seeing these cases of myocarditis from the vaccine. I've seen a couple, but not seeing like tons of it. So I wanted to make sure that it wasn't severe. And they're telling me that, nope, it's pretty mild. They resolve on their own, as opposed to myocarditis from COVID. So from the vaccine, I said 63 cases per 1 million doses, but you can get myocarditis from COVID, just like Dr. Pride-Boone said, that's MISC. And that was on the order of 450 cases per 1 million. So that is way more. And then also, like Dr. Pride-Boone said, so unfortunately with the variants with Omicron, there's going to continue to be variants if most of us don't get vaccinated. That's the problem. That's why it really does matter what we do. It does actually impact, everyone, but we're all in it together. So yes, the vaccine had a less efficacy when it comes to Omicron, but still it was there. It's not, still a good amount of protection against COVID, but yes, people were getting it still. But the amount of people that are getting significantly sick, needing to be hospitalized, was still clearly huge difference amount of people that I'm seeing coming into the hospital. They're clearly usually unvaccinated. That's one. And I was very interested to learn that. So B cells, our immune system, B cells are the cells that are triggered to make antibiotics. That's what you hope, antibodies, sorry. So that's what you hope that the vaccine will work and the antibodies will rise. So if you have a variant where the vaccine is not as great, there are also other cells, T cells, and they're the fighter cells. They're the cells that if a virus gets in, they're going to actually fight it. And the research shows that even though the vaccines may have had a little bit of a lower efficacy against Omicron, the T cells, they still were able to recognize a lot of that S protein that the vaccine was based off of. So then that made a lot of sense to me, why we were seeing maybe more cases, but the hospitalized rates was still mostly unvaccinated folks.
Absolutely. No, that makes a lot of sense. Thank you so much for clarifying that. We just want to pivot because I know LaQuetta is all on board and technical issues are resolved. So to bring you in, I guess you can kick off this question as we kind of transition to a general community thing. You know, in terms of equity and whatnot, why have people in color, do you think, in your opinion, have been disproportionately affected or impacted? I'm sure there's a ton of reasons, but just from your perspective, what's something that you saw? And then we'll open that up to other people as we transition to community questions. Okay, so it seems like that's not working. It's still muted. Okay, Brooke, can you kick us off with some things that you've seen? Obviously, people of color and other places have been disproportionately impacted. What do you think are some of the causes, and how can we move forward?
I'm sorry, LaQuetta. I really wanted to hear what you have to say. So disproportionate. So a lot, I think, is just, misinformation, right? Misinformation kind of being shared, or, there has been in the history of the medical community a lot of distrust with, in certain disproportionate communities. And when something new like this comes out, how do people know that, right, it's not experimental, or how can they trust, again, with their children? And we want to gain parents' trust. So I think there was a lot of misinformation that was being spread. A lot of it was through social media. A lot of it was through, just not science-based media platforms. And that can be really harmful in this day and age, when we don't share the right information, or they're not getting it from a trusted resource, such as a medical professional, even, going back to like your school nurse, they can provide excellent information to help kind of guide the parents. But I think that is where it stems back to, and that's why, unfortunately, the numbers were quite high in those specific communities. So
absolutely. No,
I want to share. I'm
yes,
sorry.
please.
I've just been working on an Indian reservation out in San Diego and in Albuquerque for maybe about 8 months. And so just to share the numbers, which were huge, and also a lot of data coming out of University of Chicago. Certainly we are often, as African Americans, Hispanic, frontline workers, and New York City, huge death for the people who have to use mass transit to get to work. A lot of people who rode the subways were frontline workers. We have increased rates of increased BMIs, or obesity, diabetes, hypertension. All of those put you at risk for increased episodes of COVID and death from COVID. So all of those will put you at risk for catching COVID and dying from COVID. And also low vitamin D. We talked about immune system and what can you do. Low vitamin D levels will also do it. So we definitely have an increased risk, and for that reason have to be careful when unmasking. because even though the rates are decreasing, we have to be careful because we do have increased rates of hospitalization and death from COVID and called special populations by the CDC.
Great.
Absolutely.
So Paul, I have LaQuetta is ready to answer that question.
If we got her on, let's hear LaQuetta. Welcome to the discussion. We missed you.
Hello, everyone. How are you? So I'm definitely going to say social media. Social media had a major impact on the pandemic. All platforms, not just one particular. So definitely social media. I agree.
Absolutely. Absolutely. Now, Barry, do we have some questions for the community that we want to include?
Yes, so there was one particular question that asked about can the young people get booster shots, and will they need a second booster shot in 6 months? So again, the process for booster shots for kids. For anyone.
So I don't want to misspeak. So I'm looking to the pediatricians because I was under the impression that boosters are 5 months after the primary. I'm sorry, the second shot is 5 months afterwards, and then the booster,
Booster is 5 months after your primaries.
Oh,
So it
sorry.
would be, now you moved it to 8 weeks for your second, and then 5 months after that. But boosters are not approved for 5 to 11.
Mm.
Only 12, only for the teens now, not approved for 5 to 11.
Absolutely. We also had a question from someone that's wondering, how can they best keep themselves safe with the removal of the mask mandates and things like that?
I'm sorry, there was a second part to that question. You're not approved for, unless you're immunocompromised, you don't get a second booster unless you're immunocompromised.
Absolutely. Thank you so much for that clarification. That definitely helps. That's very important. Absolutely. So yeah, the question was that now that mask mandates have been removed and things like that, what are some tips that you can recommend for people to keep themselves safe in the meantime as they proceed? And if they're still a little cautious about vaccines, what can they do as they move in that direction?
I would definitely say hand washing. Hand washing plays a major role. Try to stay 6 feet away from people still. If you want to wear a mask up, but definitely hand washing. Even when you go out to public places, you want to grab the doorknob with a paper towel. Don't wash your hands, dry your hands, and then touch the door, okay? You want to use a paper towel opening that door. Use the paper towel, turn the faucet off. We just have to be very cautious these days because we just never know. No one's being honest. We have people going around that has COVID, and they're acting like they don't. So we still want to take protocol and wash your hands, wear your mask.
Absolutely.
I think your environment matters. Like I think like LaQuetta was saying, like it's not gone. So you still have to be cognizant of that and still take, precautions and, certain environments that perhaps, that, people are not, vaccinated. It's still okay to put on a mask sometimes in certain, environments. I think you have to be selective and still be, cautious and,
Absolutely. It's definitely a new normal, for all of us. It's something that we're all getting accustomed to. And kind of in that vein, if I am vaccinated, let's say I'm vaccinated and, knock on wood, pending there's no crazy variants or anything like that, do I still have to get boosters on a yearly basis? What does that look like? Is that something that's a new part of the process? Should we expect that? And that's also open to anyone.
I don't think that we know yet as far as, I would personally guess that there will still be boosters in the future. That's what I just envision, or, a yearly, COVID test, because it's still, COVID vaccine, because it's still there. But no recommendations have been made yet. It's kind of hard to know.
Yeah. I don't think we know yet. It's still the verdict's out. it depends on what new vaccines come in, but it looks to me like it's going to be, as you said, annual boosters, probably like the endemic. Once we enter this endemic phase, it'll probably be like the flu shots. There'll be an annual COVID vaccine. If we find one that is very successful right now, as you saw with the Omicron, it prevented death and it prevented hospitalizations, but it helped with the attack rate. It was 10 times less if you were vaccinated, you had a 10 times less possibility of getting infected, but it didn't it didn't prevent you from getting it completely. So we need a more effective vaccine still. So if there is one that's more effective, there'll probably be an annual one. But because we still have we're at 65% vaccination rate nationally, we still have a problem with, as everyone has said, we still have a problem with COVID. So we need still a very good vaccine. We're still working on that. We're not there yet. So once there is one, we'll probably, like the flu, have an annual vaccine, but I don't think we have clarity around that yet.
Absolutely. LaQuetta, if you can talk to us a little bit about our immune systems, because also we have a lot of questions about masks. Which ones are the best? Is there a huge difference between them? If you could just speak to those things.
As far as the immune system go, don't smoke, eat healthy foods, your fruits, your vegetables, your whole grains. You want to exercise. You want to maintain a healthy weight. You want to get some rest, okay? All those factors has a part of your immune system. As far as the mask go, I wear N95s, which has been very effective for me. And I know a lot of other people in the medical field. However, I don't think a lot of people know how to wear a mask correctly. I think they just understand. They think they can put it over their mouth and that's okay. No, you have to cover your nose and your mouth. You want to make sure that your mask has a good seal. If you're talking and you're wearing glasses and your glasses are fogging up, you probably don't have a good seal on the mask. So now the bacteria and germs can come right on into your mask. So wearing the mask is very important. N95s are good. Amazon has them. You can go to a fit testing site as well. But make sure you are covering your nose and your mouth while you're wearing your mask.
Yeah, I agree
Absolutely.
with Peter. I think the biggest thing is the seal is what the research has shown. Like N95 is, yes, superior, but like you said, Lakita, like it needs to fit and not have, gaps, and that will be effective. Yeah. If it's a regular surgical mask, as long as it fits.
Absolutely. Now, from a pediatric perspective, Brooke, what's like the risk level for a young person who's around an adult at home, let's say at home, everyday life, pretty casual, in close proximity between dinner, TV, that kind of thing. The adult is not vaccinated, doesn't really wear a mask. Can you speak to the risk level associated with a young person in the home?
So the risk is going to be much greater to that unvaccinated child. So if there's an adult in the household that is unvaccinated, that, in day-to-day life, if they're in close proximity, they work in a space or they go to school or are in a close environment with other people, the risk of them contracting COVID and spreading it, is greater when they're unvaccinated. So, yes, those things where you're not 6 feet apart and you live in the same household, you are going to put children at risk. And obviously, we know that children with asthma, obesity, like we were saying before, the BMI is elevated. That means body mass index, which leads to, type 2 diabetes. Children that already have these underlying conditions are going to be at greatest risk if they contract COVID to possibly end up, in the hospital. And really getting vaccinated, if the adult is vaccinated, if the child is eligible, that's going to be the safest way to prevent hospitalization and or becoming severely ill from COVID-19.
Absolutely. Now, kind of in that, when we're thinking about the kids and how to keep them safe, I'm wondering, does anyone have any tips for kids who want to wear masks, have trouble wearing them in school? A lot of kids have expressed some type of fear, but is there anything you can say, any tips or tricks to kind of encourage that and just make them feel a little bit safer as they proceed?
I think just reminding the child, I don't know the age of the child, so of course it depends on the age of the child, whether the comprehension of the child of what you're trying to get across, that for the most part, we live in a good county and a good city and a good state where people, for the most part, have stepped up and have been willing to vaccinate. And that's really good, because we could live in Mississippi, we could live in Alabama, where they don't believe in vaccinating. So we're really blessed, because Albany County is like 85 to 90%. We're actually a pretty good county. So a lot of people have vaccinated, and it's really hard to live and be a child or be in a city where people don't understand. Some people can't get vaccinated, like children under 5. And some people are immunocompromised. And even if they got vaccinated, it didn't work because their immune system is not competent, and it just doesn't work for them, or it didn't work really well. And some children have diseases where no matter what they do, they cannot fight off COVID, and they have to wear masks, because if they don't, they're going to get terribly sick and be in a hospital. And unfortunately, we live in a society where everybody says, what the heck, that's your problem. And I'm not putting on a mask because I'm done with it. I'm sick of the mask. I'm done with COVID. And I get it. We're all done with COVID. We all want to be free and be done. But guess what? There are people in the world who just can't afford to get COVID. And so this poor child, children under 5, toddlers, they're like, please, I don't want COVID, but the world's done with COVID. And so to tell this child that fortunately you live in a town and a city where COVID's almost done. It's like the flu at this point. Thank the Lord. So we're at low levels now. And that's the good news. It's not March 2021. It's not March 2020, where the levels were sky high, where every other person had COVID. Right now, most of us don't. And that's the good news. COVID's really, really down right now. Right now, we're at like 7 per 100,000 people. That's a very low number. We're getting at flu levels now. So tell your child it's really low. Most people don't have COVID right now. That's really good news. And if they wear a mask and they wash their hands and they try to distance, they are still doing 3 feet at school so far, pretty good. They're probably going to be okay, because right now the community levels are low enough that they're probably going to be okay. So if they keep their masks on, wash their hands, they're probably pretty safe. When the levels go up, hopefully the adults in the room will tell everybody, put your mask back on, wash your hands, and socially distance again. So we do live in a state that has pretty good public health officials that do recognize that children and people need to be kept safe. We don't live in a state that closes their eyes and says, oh, what the heck? We do live in a state that does watch the numbers and will say, you know what? The numbers are on the rise. BA2 is out of control. We got to socially distance. We got to put our masks back on. We have to do the right thing. Our children are in a bad situation. We have to look out for the immunocompromised too. So I think if they wear their masks, even if all their friends don't, and they are washing their hands, the numbers are so low now that they're probably going to be okay, as long as they keep their masks, as LaQuetta said, well fitted, washing their hands. So few people have it now in our counties that they should be okay. So I would reassure them that the adults in the room are watching the numbers, and the numbers are low enough that if they do the right thing, even if their friends around them are not necessarily doing the right thing, we're low enough now that it's safe enough that they don't have to think it's around me all the time. It really was. 2 months ago, it was all around us, but right now the numbers are down. So it is a lot safer than it was 2 months ago.
That helps a lot. I know the young person wearing a mask will help understand that it's a much safer place than it was before. Plus, when wearing the mask, it puts you in a very, very safe position.
And we said it, N95. Remember, N95 gives you 24 hours coverage. A surgical mask gives you 30 minutes of coverage. A regular cloth mask, 20 minutes. The Omicron was in. So the best mask you can, with the best fit that you can, will give you lots of protection. But tell that to a 2 or 3 year old. They're like, da, 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 right?
Absolutely. I mean, the protecting you versus protecting others, that's always a huge part of the conversation. There's always a disconnect. A lot of people just don't understand some of these things. Dr. Pinto, can you kind of explain the difference between, like, people have said, if I have mild symptoms, am I less infectious? Does that necessarily hold up, or how does that work?
Yeah, unfortunately, COVID is such a masquerader. Having no symptoms or having very mild symptoms of mild sore throat versus, hacking up a lung doesn't mean that you're more infectious. I wish that it was that, clear cut. I mean, you are infectious 2 days even before you start showing your symptoms. So unfortunately, as long as we are at risk of getting COVID ourselves, you can always pass it on. And that's why the vaccines were so crucial, because it did not make it so that you just were not going to get COVID. We got that. But it is strongly felt that it does decrease the chances of you being able to transmit it. It's hard to tell exactly how much, especially with all these variants, but it does help at least decrease that chance a bit. So no, the severity of the symptoms just doesn't help with that.
That would have sounded great, but we're everybody's just trying to figure out how to stay safe, and at home tests have been a great part of that. LaQuetta, can you talk to us? Have you ever seen do home tests expire? Can I just keep them forever, or how does that work?
Thank you. Of course, everything expires in this world today. Home test has been, I'm gonna say, pretty accurate. I know a lot of people that, I've tested, it came up positive, PCR came back positive, they had COVID. Then in the beginning, we was hearing, the rapid was negative, my PCR is positive. I don't believe in a rapid. Well, guess what? When did you take your rapid? Same thing as Dr. Pinto said, the virus starts 2 days prior, right? Rapid tests, they do expire, but they also have to make sure that they do the quality controls. You can't just open a new box if you have a full box and start testing yourself. You want to make sure it's up and running properly, just for manufacturer problems, what's in that box.
Absolutely. Man, that's something that everyone should be mindful of. I'm sorry, Dr. Pinto, were you going to say something?
I did not know the answer to how long the home tests last if they expire. I've never even thought about that, but it's a good question. I'm just looking it up online. I'll be honest, I did not know the answer. So, but it says Binax now, which is one I've seen a lot. They extended it to 12 months shelf life. And then some of the other ones are for about 8 months. So I guess that gives us an idea of when it will expire. Yeah.
Absolutely. No, that helps a lot. And this is the kind of question and response. We're just trying to answer everybody's questions as best as possible. So we appreciate you doing research right live with us. That's great.
Paul, can I offer, there's a really important question that came from the community regarding mental health. And I think all of the panelists, when we talk about young people understanding the vaccines, their parents understanding the vaccines, masks, but this question is really good regarding mental health and young people being bullied because they're wearing a mask, right? But also just understanding the shifting back from being safe, unsafe, like that's a whole lot of kind of figuring it out as a young person. And so I guess for all of you all, what does that look like for you?
Did you see DeSantis, the governor of Florida, bully the teenagers on his platform? He bullied 5 teenagers in front of the press just a couple of days ago. And everybody called him out. It was horrible. He had a group of teenagers and they were all doing the right thing by wearing a mask. And he said, "What is this, mass theater?" I mean, it was horrible. Those young people had the right to wear the mask, just like he has a right not to wear a mask. And the teachers and the principals have to stand up for the children. You do not know the health risks and health history of anybody, and you do not know why or why not people choose to wear masks. And you have the freedom to wear or not wear. And schools have to stand up for these children. You do not know, when we say mask or unmasked, that means the freedom to do otherwise. Unless there's a mask mandate, we should have that freedom. And no governor or otherwise should bully a child. No, how can an adult, and if children will bully, there's the nature of children, but as adults, we need to teach not to bully. And part of it includes masking. Now we just have another vehicle in which children can bully. And we need to stand up and teach. That's part of the adults in the room, is to add this to the list of how we don't bully and why we don't bully. Because you choose to be safe. It is not zero. 1,500 people will die today. Anywhere from 1,500 to 2,000 people will die today from COVID. COVID is not gone. It's just a lot better than it was, but it is not gone. And there's some, I forget how many will die in our state. We didn't lose anybody in the last couple of days in our county, in our area, but some 1,500 Americans will die today from COVID. They have every right to put their mask on.
Yeah, and I've been nervous about this. Fortunately, my 2-year-old does not have to worry about this at this, time, but I've always wondered how the kids are going to deal with it. I just came from William Hackett Middle School right before this event, and because me and my colleague were doing like a mentoring thing with the middle school there, and most of the kids had their mask off because now the mandate has been lifted, but a couple of them had it on, and I was very happy to see that it didn't seem like there was a spotlight on them. They were just all, coexistent and just, but yes, I've been nervous about how that's going to work out in schools, because I'm sure it'll be something, unfortunately.
Yeah, it definitely will. That's something, and I think that helps just to know that our administrators are informed, they're aware of these issues and they're responding accordingly. Keeping our kids safe physically as well as mentally is very important. It's always about hearts and minds. And with that being said, hey, LaQuetta, you see how I did that there? Yeah. But LaQuetta, can you just let us know any parting thoughts? We're getting towards the end here. Let us know what you think about things. What should people be doing? How can we best keep each other safe?
I think everyone should get vaccinated. I think everyone should get boosted. I think everyone should also still wash their hands, wear their mask, and let's be great again.
Absolutely. Brooke, do you have any final thoughts, any parting ideas, wisdom to impart?
Thank you all for having me. I think this has been, very informative, and hopefully we helped some parents in our community. But I agree, just, talk to, your healthcare professional. If you have questions or concerns about getting your child vaccinated, remember, we're all supportive of it. We do it, day in and day out, and it's proven to be very, very safe and effective. And we just want to keep these kids as safe as possible so that, hopefully, in the future, this is just a discussion that was in the past. So thank you all again.
Absolutely. There was one question that I guess as we wrap, Dr. Pinto, if you want to kind of speak to the question of natural immunity, people are wondering how that kind of plays into the vaccine efforts and how you guys feel about that.
Yeah, natural immunity is real. Of course, when you have the illness yourself, your body will make some form of antibodies to it. But the truth is that it's just not known how much of an antibody response that you're going to make. And the concern is that it may not be enough, or it may not be for long enough. And so it's been felt that the vaccines, if you get the full vaccination and boosted, and that protection would be longer lasting and more definitive. So, in a world where we're trying to get everyone or most everyone vaccinated so we can reach herd immunity, vaccines become important, because you just cannot rely on the natural immunity that would require many more people to get COVID and potentially die from COVID. It's just the risk would just be way too much. It would be invaluable like lives for us to get this natural immunity, as opposed to a vaccine that has been proven over and over and over again to be safe. So weighing risk and benefits.
And I want to, and I thank you for that. And I want to mention that there are people who are exposed over and over and over again to COVID and never get COVID. And so the CDC is trying to study those people and figure out what about their immunity makes them able to ward off COVID. And so we need to learn more about them, but no one knows what exactly about their immunity is working. For instance, children have the ACE2 receptor. Their ACE2 receptor in their lungs makes them more likely to ward off COVID, unlike adults. Children, as you know, are less likely to get COVID, and they're less likely to be sick from COVID, unlike adults, more likely to pick it up, more likely to die from COVID. Their ACE2 receptor in their lungs is not as effective as an adult ACE2 receptor. So they're looking at the ACE2 receptor, and these people who are less likely to get COVID, never get COVID. They often work on the wards where we work, Pinto, and never get COVID. It's like amazing. Now they're often vaccinated, but they think it's something even different. They're smart enough to get vaccinated, like we're not gonna play, but there's something unique about their immune system that they never pick it up, and they're exposed, and they just never ever get it. So people start, what is this about their immunity? And I know there are people who never get sick. And we're on the lookout to figure out what it is about these folks. And we can bottle it, we're all going to get it. But right now, we know what works, and we got to go at what works. Until we figure out who they are and what they have and how do we get it, we have to do it what we know and run with that. And that's what smart people do. Run with what you know, go at what you know, stay out of the hospital and try not to die because your children need you. And keep your children safe and run with what you know until we know when we have that magic potion, we got to go at what we know. But we're looking for natural immunity. We're looking for it. But there are some people who have it. We just haven't coined it yet. But trust me, the pharmaceuticals are after it. So
I'm sure. No, that helps a lot. These questions we get from a lot of people. So we're definitely recording this. The link will be available at the same link that everybody clicked to join. So if you have anybody who has those questions, everyone feel free to share this. And if it helps shed light for somebody, that's what it's here for. With that being said, I'd like to toss to Miss Natisha Alexander so she can say a few words.
Thank you very much. I first want to thank the panelists. Thank you to Dr. Pride-Boone and Dr. Pinto and Brooke, and to LaQuetta for taking the opportunity out of your busy schedules to have such a very important and informative discussion. Our community needs it, our people need it, and our parents need it, our students need it. So thank you very much. It was very informative. My daughter's only 3 years old, so she's not eligible, but I learned a lot of information. I'm sure others have also. And I'm walking away with some very helpful information and thought, things to help me think about when she does become available, when the vaccine is available for her, whether she will get it or not. So I do encourage people who are on the Zoom, if you know someone who wants this information, who have the same questions that were asked and answered, or have other questions, to please send this link to them so that they can view the recording, or reach out to AFE so that we can connect you with these experts that have been sitting on this panel tonight, so that we can get you the information that you need, because this is very important information. So thank you. Am I missing anything, Barry?
Nope, I think that's it. Dr. Pride-Boone wanted to make an offer about a vaccine.
Yes, thank you, Barry. You're so kind. Thank you for reminding me. Philip Schuyler tomorrow, 4:30 to 7, is offering a vaccine clinic, and Brian, the second school, Saturday. Brighter Choice on Saturday at, what was that time, Brian? I think it's at 11 a.m. Brighter Choice on Saturday for 1 hour, and they will extend it another hour if more people show up on Saturday morning. So
And
thank
the
you.
vaccination site at Cross Gates is still open. So there are many opportunities. These are all free of charge. Regardless of whether you have health insurance or don't have health insurance, you will not be charged to have the vaccines.
Thank you. Oh, I'm sorry, I misspoke. It's 10 to 11 on Saturday at Brighter Choice, and 4:30 to 7 at Philip Schuyler.
And also on March 12th between 9 a.m. and 2 p.m., you can go get vaccinated at the Troy Farmers Market.
And so if you have any further questions, certainly reach out to your healthcare provider because they know your specific situation and have a good, thorough conversation with them about where you are and for yourself and for your children and your families. Thank you very much for joining us, and please do follow social media. Follow us on Facebook, on Twitter, on Instagram, Albany Fund for Education. Take good care of yourself. Wash your hands. Don't touch your face. Open a window and get vaccinated. Have a good night. Thank you.
Thank you.